Hi, I'm Bubbers-Jones, the Medical Director of Medic Footprints, and this is one of the series of our videos on the medical technology world. As you're probably aware, it is growing, and I've got Giles here. He's been involved in user experience, or UX. So Giles, thanks for coming today. Tell us a bit about your background before we get started.
So born and raised in East London, trained at Barton, London, so again in East London. Then worked as a doctor for 3 years in the northeast of Yorkshire. But quickly after working as a doctor, probably even after about 4 or 5 months, I realised I really like my probably first passion, which is IT, but also being creative in art and design, web design, things like that. And so now I work as a clinical user experience designer.
Full time?
Yes, full time.
No clinical work whatsoever?
No clinical time.
Amazing. What was the transition like?
It was tricky. It is easy to feel guilty when you transition into a new career outside of medicine, but this is the happiest I've ever been, and I'm now in a position to impact the lives of millions of patients through the work that I do now.
Okay, so tell me, what does UX mean, or what is that about?
So as you said, UX is short for user experience, which relates to the experiences that people have when they're interacting with the world around them. More specifically, we refer to UX with regards to the experience people have when using technology.
Right.
So if you're interacting with your mobile phone, a desktop computer, even machinery.
So from a healthcare perspective, it's what we use on the wards, or the computer software. It seems to be different from every hospital you go to. It seems to freeze when you most need it. And the other day, our whole systems went down. So that kind of service that you're talking about.
Yes, that's a big part of it. There's more though, because as you've explained, there's a lot of software that's used in a hospital setting that can fail. It's not very usable. There's times when it lets you down in ways that you weren't expecting. But equally, there's issues that patients face when there's a lot of apps that people can use for various health conditions, especially mental health conditions, and these apps are not really valid. They're not really verified that can provide a service that they can.
So why don't you tell me a bit about some of the projects that you're working on at the moment?
So at the moment, one of the projects, for example, was from a hackathon I did, which was a weekend of coding and for a specific cause, which this case was looking at technology enhanced learning for health education in England. And the team and I created a solution we've called ECHO, short for Easy Contextual Hospital Orientation.
Well done.
So ECHO is a means to, not through e-learning specifically, but a means to replace a lot of the demand that doctors have when they have to have induction on the wards, particularly those on a night shift or doing a locum shift, where they need a lot of information in a very short period of time with very short notice. So we're trying to disrupt that problem that's a lot of doctors face at the moment, because it costs a lot of money to have induction for doctors.
So I mean, I know quite a few doctors who would easily be able to contribute to user experience. I mean, they're still working clinical medicine. How do they get involved in these kind of projects?
So there's quite a few things. The first thing is try and actually speak with IT professionals in the work environment that you have. There will always be projects where, if it's for the benefit of doctors or patients, if a doctor is keen to help, they will be really keen to talk to you in return. So put yourself forward is what I would recommend. The next thing is actually try and understand that world a little bit more. You don't have to be a coder. You don't have to be a visual designer. But you need to understand some of the technologies that are used, some of the issues people have, and apart from reading books, which is an obvious way of Googling, another great way of understanding this is, again, talking to IT professionals. So being part of the community that's solving the problems or causing the problems that you want to be solved relating to IT in the healthcare sector.
Well, thank you for coming today, Giles. And I'm sure that people can try and get in contact with you somehow if they've got any further questions about UX.
Yes, they can get through to me through my website, so that's dr-.co.uk, dr- then the word -.co.uk, or gm@dr-.co.uk.
Okay, well, thanks for coming again, and we'll see you next time with our next MedTech video.